Good afternoon. Welcome to this week's update here in St. Clair County. I'm Homeland Security Director Justin Westmiller, and with me today I have Dr. Annette Mercatante, the St. Clair County Health Officer, as she gets a little adjusted there. So that's right. Okay. So I think we'll get right to it and get to the stats, and then we'll go from there. So totals to date, 7,457 total cases with 412 hospitalized, 172 deaths, and 4,184 recovered. Changes in the last 7 days, 369 new cases. That puts us at an average of 52.7 new cases per day. And we're averaging about 319 tests per day. Currently, we're at 13.1% positive on our testing. So this is the curve. As you can see, we've come down quite a bit from the peak, and we're seeing just a little oscillation back and forth right now at our current level. So there's room to get a lot better, but it's not quite as bad as it was. And this is just our percent positive for testing scale that we've been showing for many, many months, showing that we're holding pretty close to that 10 to 15%. All right, and a new one that you saw last week, this is our coronavirus vaccine dashboard. And to date in the county, 1,667 doses have been administered. But I do want to warn everybody that this dashboard is just over a week and a half old, and it's still got a lot of growing to do. So take it with the information that's presented, but don't let the colors bother you right now until we get a little deeper into this. And then finally, our COVID dashboard that you can get at stclaircounty.org/offices/health/COVID19.aspx. This just shows our information. And then finally, the last slide is now that the update came out from the governor this week, this is how we're rolling it out. And it was just released a couple hours ago today. I know that the Times-Herald is doing a story on it, as well as this will be up on all the Health Department and Emergency Management websites. And that's it. Did I miss anything, Doc?
No, but I think before we get to your questions, most of the questions that we received already are clearly about vaccine. Frozen.
There we go.
Yes,
we're back.
I hope. Okay.
You got me? Okay. And actually, I didn't have my hotspot on, so let's try and do that again. So we'll start out with discussing vaccine, what we have in place, what we plan to have in place, and then the things that we don't answer, then we'll take your questions. So vaccine has been delivered to us and our hospital systems now for several weeks. And I would say in relatively small quantities. As you know, we received Moderna vaccine, and then about a week ago, we were told that the remainder of the Moderna stockpile was being distributed to pharmacies so that they could vaccinate long-term care facilities, adult foster care homes, and other high-risk aggregates or congregate settings like that. So the Moderna vaccine supply on our end for first doses has kind of been put on hold until probably the week of January 24th, where we're told we can then get more vaccine. Now, we can still get second doses. So all of you who received Moderna vaccine from us or from other people, no worries. The second dose has been withheld and we can get that. But in the meantime, what do? Our original plan was let the hospitals continue their vaccinating and with their Pfizer product, and we would then provide more vaccine as became available. But the governor's announcement did kind of put a little pause on that, thinking, oh, we have to move forward with whatever product we can get. And so we have submitted for Pfizer product to proceed with that. And then eventually, as we move, we'll continue with both products. But even with the Pfizer product, we were the exact amount of allocations for that product are still not clear to us. And we were told that without a doubt, whatever we ordered, we needed to use within 7 days. So we can't sit on vaccine. We're using our vaccine as quickly as possible. But for the upcoming vaccination week, so this week we had all our vaccination clinics. We've used all the vaccination allocations that we have. Those of you who are in our clinics, thank you. And I know that those of you who tried to get in will have to just wait till more vaccine clinics open. But we did open and expand 2 more vaccine clinics next week, as well as the 2 in Yale and Algonac. They were expanded. And I did just recently check, and there's not a whole lot of appointments left there either, people, so I'm sorry. But through next week, then we will be using our Pfizer product as well. And that means that we will be able to distribute it a little over 1,400 doses of vaccine next week. That's all the vaccine we have. And meanwhile, the hospitals are continuing to use their vaccine product for their population. So if you're in a hospital setting or a hospital employee, I would urge you to seek your vaccine there. You might have a better chance of getting it. So what does this mean? This means that as much vaccine as we can get our hands on, we will expand the clinics to accommodate that. And that also means that you're going to have to frequently check back on our webpage, scchealth.co, to see where these clinics are and whether or not there are appointment spaces available. So that's the status of vaccines. And as long as we are uncertain about how much vaccine we can get, we will continue to order more and more each week so that we can distribute more and more. But that's the situation we're in. We can't order vaccine that we can't use. And at this time, we can only use as much as we have the capacity for running the clinics. We are absolutely looking for volunteers and other creative resources to vaccinate. We know that we can't do this as a health department solely based on the process that we've already got in place. And we will be looking at finding other ways of vaccinating through community programs, community agencies, etc. If you are interested in volunteering to help us vaccinate, you need to register through the My Volunteer app or website, which is MI Volunteer, VOLUNTEER, and you create you log in, you create a password for yourself, and you get the information, and then we pull your information from that, which simplifies the system. So, Justin, did I forget anything?
No, I think you totally covered it.
Okay. Now, I will say that if we understand that not everybody is tech savvy, especially if you're looking at some of our elderly who maybe don't know how to click onto a link and actually the application process or the not application process, the registration process through the link is very, very simple. But if for some reason you can't use that link, we'll ask you for now to call us. And we will walk you through that ourselves, 987-5300. However, we will have a dedicated phone number for that in the near future, and that'll probably be right next to the link, and we'll supply that so that if you don't want to use the computer or the link, you can call a number and try to get an appointment that way.
Doc, just one edit on your comment. We
Yes.
ask people that they don't call because those clinics are already booked up for next week.
Well, okay, good point. And I guess there's a solid. They're going to have to though, Jen. But we'll have. But for next week, there is no point in calling because we have nowhere to put you. So please don't call us now. And that also say we don't have a list. People, we are not keeping a list of people that are waiting for vaccine to call them back when a vaccine is available. There are just way too many people. In fact, Justin and I were looking at just the 1B group. There's probably over 60,000 people in that single group alone that are currently eligible for vaccine. And so you can see that we really have to adjust our strategy. We can't keep a list of people and then call them back. So we're asking you to keep your eyes peeled on our website. We'll also use media, social media ways of letting people know when these clinics are reopened. We will know early next week or midweek for the following week what we have planned. So I don't know that Monday would be a good day to jump on and try and schedule for the following week, but certainly midweek, start looking at our website to find what you can do for the week of, that would be the week of June 18th. Excuse me, January 18th. June. I wish it was June. I wish it was July.
And if I can just add a couple of things too. The entire state has only put about 367,000 doses in. And so this still remains a very scarce resource for all 83 counties in the state. And you can be rest assured that both divisions here, Health Department and Emergency Management, are working around the clock to get more resources and more vaccine available so that we can push this along.
That's a really good point. And I think we want to make sure that people put this in perspective a little bit. You know, this pandemic has been raging now for almost a year. All of us have been kind of struggling with whether to go out, whether to stay in. We've just got through some pretty lonely holiday times. And the vaccine is definitely a ray of hope. But we have to realize that there's no one had promised that the minute this vaccine came out, it would be available to everyone, which is why the priority groups were so important. We started thinking about how can we do this in a just and equitable way. It is going to take a while to get the vaccine to everybody. And don't forget that if one vaccine, especially with the two products we have right now, the Pfizer and Moderna vaccines, are not protective after one vaccine. You need two vaccines and probably a good week after the second dose to assume that you have immunity. So even if you got your vaccine yesterday, we still have to be cautious and take our time understanding that it's going to be a while. It is going to be months before we have enough immunity in this community to breathe a sigh of relief. And the fact that I think it's going to be the end of this year, to be perfectly honest with you. So we have to be patient. We cannot assume that you can get to this vaccine next week. We will continue to do our best, but this is a very limited resource. And it's okay that you have to wait because we've been doing this already for so long. You guys know what to do, but we're going to be able to do this. It's just, it's going to take some time.
Exactly. Okay. Thanks for saying that, Doc. Okay. Are you ready for some questions?
Ready.
All right. If our county's not prepared to give the vaccine to those included in the governor's new orders, can they go elsewhere, like on a referral basis?
Okay.
Do we know that?
Well, yeah, I'll take offense if I say that we're not prepared. We're as prepared as we could possibly be. The real question is if we can't get vaccine to distribute, and if we go through with our allocation for the week, which will typically be a minimum of 1,000 doses, and you feel like you can get your vaccine somewhere else, go for it. Just remember, your second dose has to be the same as the first dose. You don't want to switch Moderna for Pfizer.
Yeah. Okay. So it looks like she's stuck. So what Doc's saying is that, you have to continue with the same product that you got, whether it's Pfizer at 21 days or Moderna at 28 days. So just stay with us, and we're going to continue to be working this issue every day to make sure we have what we need for our county.
Thank you, Justin. Okay, next question.
Oh, wait, we should go back to that Jen, because she also asked about getting a referral. You don't need a referral from us. No, this is a free resource for anybody who is eligible, and it's not based on what county you live in or even what state you live in. So just if you have access to a vaccine somewhere, good luck, go for it.
Okay. All right. Next question. If you are under 65 with multiple underlying conditions, which phase would you be in?
You're 1C phase 2, correct? I think that's where those.
In other words, you're not up yet.
Yeah.
But the way this is rolling out, I got to tell you, people, the way this is rolling out, that there's no way we're going to finish an entire priority group before we
Right.
move on to another priority group. So those of you who are the under 65 and not in an essential worker group and have chronic problems, I would say just hold on. It's not going to be a terribly long time before they just open this up to anybody who wants it. But that's probably going to happen when we have a really good handle on how much vaccine we're going to be able to receive on a regular basis. That's really the limiting factor. Not knowing how to plan clinics is really because we don't know how many vaccines we have to distribute. So it's not as bad as it sounds, but you're not up yet.
And I just want to add one last thing. Remember, everybody, that as soon as the additional vaccines come online, that adds to the pot, right? It makes it a little more difficult for people like Dr. Mercatante. But I'm telling you that as the resource guy, we're going to be constantly grabbing for everything that's available. So those timelines will shorten a little bit as we get more vaccine capability in the county.
Okay.
And we have a lot of vaccine providers that have registered and been approved in our county, pharmacies, and I believe even physicians' offices. They just don't have vaccine yet. So This is going to open up. I don't know if it's going to open up like a floodplain or it's going to open up in little fits and starts, but we will get there.
Okay. How many new cases of the virus are there? Justin, I think you mentioned that at the beginning.
Yeah, I mentioned it. It's 365, I believe. Am I close, Brandon?
In the past week?
Yeah.
Yeah, in the past week.
369. Hey,
Yeah,
I missed it by 4.
week.
That's pretty good.
And I'll just make a comment about diagnosis over the holidays. Take it with a grain of salt. Testing was down. Reporting was down. The system was down several times. Staffing was at, just minimal levels because of the holidays. So for those 369 cases, and I've said this before, for the cases we identify, you can safely assume there's 3 to 5 more. So we have come down, as Justin said, but I believe we're still in a dangerously high level. We're still at a pretty high level of transmission. And what concerns me more is we've seen that graph come down, and now we're seeing it's almost kind of it's plateauing at this new high level. And certainly that's not a great sign. So please keep your guard up.
Yeah, and that you can also see, right, by the 13.8% or 13.1% positivity in the tests that we are doing. So as long as that number remains high, we're fairly confident, as Doc said, that there's that's dangerous levels of transmission in our community.
Okay. Does someone with a history of allergic reactions need a doctor's approval in writing before getting the vaccine?
Only if you have had an anaphylactic reaction to a previous component of a vaccine similar to what's in the COVID. So there's these lipid components that they're rare, but an allergic component to the PEG or polysorbate, I think is the other one they've come up with now. So those are precautions. And if you go to an allergist and he says, no, it's okay, we can still provide it. But that's the only time we really ask for a specific clearance. If you're just allergic to a food product or peanuts or something like that, you do not need any kind of medical clearance, no.
So if someone has a serious lung condition, can they get an appointment for the vaccine?
Yes. So there is no medical reasons why you can't get a vaccine. Now, I think Justin was going to comment about the priority group. So the priority groups are over 65 and our essential workers, right? So including our teachers and our cops and our firemen, that's what we're doing right now. But if you're over 65 and you have a serious lung condition, then you can receive the vaccine. Any chronic medical condition is not a contraindication to the vaccine at this time. So, or at least with the vaccines that we have right now, what we know of. So the only reason you could not get this vaccine, assuming that you are eligible for it and you have access to it, would be that if you've had a serious anaphylactic reaction to the vaccine itself or one of its components previously. So medical
And just to
conditions
answer-
are listed.
Yeah, just to answer her follow-up question, right now there's no appeal process, right? We're following the phases as they've been directed by the governor and Dr. Caldoun, and so you'll just have to wait until we get to the full rollout of 1C.
Yeah, and we'll let
And
everybody
continue
know.
to be careful. And
Yes.
just continue, please, people, just continue to be careful, because you're absolutely right. When you have medical conditions like that, you have increased risk. So please don't let down your guard. Wear your masks. Don't go into crowds. I know this is hard, but this is the hardest part, I think, because we see a solution and you can't grab it. It's like cotton candy, right? You want to get your hands around it and it melts. And so I think the frustration levels is more acutely felt because of that. But you do know what to do, people. Just avoid those infections for as much as possible, and we'll get to you.
Do we know when residents of nursing homes will be up, and who will be doing
Well,
those?
they're up now. So the plan that has been developed through the federal government is that all nursing homes, congregate settings, adult foster care homes, etc., are all going to be vaccinated through a large federal plan through Walgreens and CVS. And they have received their vaccine or are receiving it now as we speak. And I understand the vaccine process has begun. It is my understanding that they would hope to achieve vaccinations for most of those individuals within 3 weeks, is I think the state's hope. Whether that'll be achieved or not, I can't because it's not our plan, nor is it our vaccine. However, I can tell you that the local health departments throughout the state are on standby to assist with this if we need to and if we're asked to. But right now, we are asking those facilities to wait and be vaccinated by the Walgreens CVS process that was set up for them.
Okay.
And they should be contacted very soon. Very soon.
Are the booster doses different than the initial doses? And do you expect to have them available by the time they are recommended to administer for those who did receive their first dose?
Mm-hmm. Well, technically it's not a booster dose, it's a second dose. And it is the same dose as the first dose. And I mentioned already you need the same product as well. And it will be available. We have been reassured multiple times that second doses of these vaccines have actually been withheld on purpose. So if St. Clair County orders 975 doses of a vaccine, another 975 doses has been put aside at the federal level. And certainly the state is doing this as well to assure that when it's time for us, and when we order based on first or second doses. So I'm pretty confident that anyone who gets a first dose will have access to their second dose.
Okay. Are people, excuse me, being tested for the strain that's in the UK here in our country?
Yeah. So we just had a discussion with our Bureau of Labs, and I'm sure the labs throughout the country are doing this. I'm not sure of the process of how they make the selections. Of course, not all specimens go through the state's Bureau of Labs. So remember, this is not everybody who's tested, but the Bureau of Labs of the state is running specimens that they receive, any specimens that they receive, through the genetic sequencer, which is not apparently a simple process. It takes upward of 3 to 4 days. It is a process that's so long. And as of 2 days ago, we were told that there has not been any of the UK variant yet found in Michigan. But I have to say, the assumption is it is here, since it's been found throughout the country in people who haven't traveled. So I do think it will be identified. And what we can hope for at this time is that there will be no significant impact on severity or on the vaccine or on testing, all of which look like that's the case. The variant is easier to transmit, which might mean it's a little harder to deal with it just based on masking and distancing alone. But with that same token, that it's not more, doesn't create more severe illness, and that testing and vaccines should still be very effective.
Okay. Somebody commented that it's crazy they have all these vaccines and no one to distribute them, for goodness sakes. So do you have any comments on that?
I'll take that one. I would say that we have absolutely the resources we need to do with the vaccine levels that we're getting right now, and we have both plans in place and people in place to do the ramp up when it's required. So that is not the case here in St. Clair County.
Well, I think you also have to understand, let's face it, it's a lot of vaccinations, and you're right. I mean, we don't even have a small percentage of the vaccine we need. We're still talking about hundreds of thousands of millions of doses. Every vaccine we provide takes at least 15 to 20 minutes. It takes a lot of resources. So I don't think it's hard to understand that it's easier to make a vaccine than it is to inject a vaccine and actually get it into people's arms. This has always been kind of you can say, here's a bunch of vaccine, but we've always known that the real challenge is going to be getting it in people's arms. So I agree with Justin. I think we can get this done. What I don't think we can do or expect, what anyone can expect, is we can get it done as quickly as the vaccine is actually dropped on our doorstep, because it's just not that simple.
Okay. Somebody said that, what about SC4 nursing program or Ross medical students? Would they be able to volunteer?
Yeah, and they are included in our volunteer registry already. Both SC4 and a couple other groups are on our weekly call to ensure readiness. So yes, they are included.
All right, back to somebody had said they tried to register for an appointment several times today, and they couldn't. So can you just reiterate that we are booked up?
We are booked up for all of the vaccines that we set up today for next week. So we had a couple vaccines already up and running that were up there in Yale and Algonac. We expanded those to vaccinate more people, and we added 2 extra vaccine clinics the following 2 days, and they are all booked up. And so the demand is great. I just want to say, we can look at this and go, oh no, but I want to say this is great that so many people want this vaccine. And I just want to thank those of you who are getting it, and just encourage you to be patient. And again, jump on our website early next week, and we should have some more things up and going by then.
Okay. My parents just had their second shingles shot. How soon can they get their COVID immunizations?
14 days. We're asking people to wait to distance the vaccine from the COVID vaccine by about 14 days. And that's no, we're not sure for sure. It's just kind of a safety measure that they've come up with. And
this is a question I've heard. What if you've been sick, per se? Should you get your vaccination when you've been sick? If you're sick?
Well, we want you to be feeling better. You never want to get vaccinated while you're acutely ill. So you want to wait till your fevers are gone. You want to make sure that you're feeling better. Okay. And remember that this vaccine has a fair amount of reactivity to it. It means a lot of people do feel kind of achy, have some low-grade fevers and some local tenderness with it. So you can expect that. So if you're okay with that, in addition to the way you're already feeling and you're clearly getting better, then yeah, you can get the vaccine. But I would say if you're ill, number one, if you're ill, make sure you don't have COVID. Because for all the reasons, we don't want you to be out and about, and certainly don't want you to be in our clinics. And that reminds me, if you have an exposure to COVID and you've been advised to quarantine, that is also not a good time to come in and get a vaccine. We're asking people who are in quarantine to not present to our vaccine clinics, and that's for the safety of other people and our staff. Okay, so those would be the 2 things. And if you've had COVID, we ask that you've recovered from COVID before you get the vaccine. And I'll just say that given the current restriction on capacity we have right now, then the assumption that most people after recovering from COVID infection won't get reinfected for about 3 months or 90 days, that you might want to just kind of roll with it a few weeks before you start getting your vaccine. You can get your vaccine if you choose to, but you can also delay your vaccine for 90 days. And I'll just say it makes kind of sense to me that those of us who've been recently infected kind of step back and let other people come to the front of the line and get these vaccines while they're still so hard to get. That's just my suggestion. It's not one of our requirements, but it does make some sense.
Okay. How is it more safe for schools to reopen in our area next week than it was when we closed down, with the percent of positivity rate still being at 13% plus?
I wouldn't say it's any safer or not safer. What we've learned, though, is that school transmission is kind of rare. Schools are not a particularly dangerous place for our kids to be. If the teachers are following all the safety measures, the masking, if the masking is done and the social distancing is done, and kids aren't coming to school sick and teachers aren't coming to school sick, we really don't see a lot of COVID transmission within school buildings. Most of the people that end up getting COVID got sick from exposures in their households or from social gatherings that they've done outside the school. So you weigh that against the risk of just continuing our kids not being in school. We absolutely know they do better with in-person learning. And I think most of the people who study education and this disease are starting to go, look, this COVID thing is going to be with us for a long time. In the meantime, we have to make sure that all the secondary collateral damage isn't as horrible as the disease itself. And these kids, I think if we can get them to school, keep the teachers in a reasonably safe place, especially if we can implement testing and vaccines into that whole scenario, that we can actually get our kids back to school and back to learning where they need to be. So it's not that it's any different. I think we just know more and we have better tools that we'll be able to utilize to add to that bubble of protection. Justin, do you have anything to add to that? Yeah.
Yeah, and the schools as institutions are holding to the mitigation efforts, much better than some other places. So that just adds to that plus number, making it safer for kids and staff to go back to school. And then every once in a while, we have a school system who's having staffing issues, and then the health department is working with them to do the best they can to get through that situation.
Yeah, we're probably still going to have situations where the school starts and then there's a little outbreak and we got to, shut the classroom down. It's still going to happen. I absolutely guarantee you it's still going to happen. But you got to figure we got to try, right? And this is how we got to try. We have to try and live our lives here while we fight this virus, because the stakes are pretty high by keeping our kids home much longer.
Speaking of schools, somebody said, will you be able to contact trace, excuse me, the positive cases that do happen in schools?
Sure, if we know about them. So if you get tested through a lab and that lab reports that test to us, or if you get tested and you report it to us, and there is a reporting mechanism, I'll remind people on our website that if you test positive or you're an employer and you have employees that test positive, you can submit your results to us and we'll give you a call and we'll do your case investigation and we'll get you in the system so that you have that monitoring and that. Sorry.
Yeah, we're clearly having issues today.
So we're going to continue to do everything we've been doing. And actually, as the cases come down, we're actually able to keep up with it a little better. And we're learning about how to do this better. We have some nifty systems that are coming into place that'll help us do this a little more efficiently as well. So, yep.
Yeah, the one thing I have to add to that is there's many reports of people knowing that they're sick, potentially COVID positive, and they're not getting tested because they're afraid that they're going to have to be quarantined or isolated, and their kids are going to have to be quarantined. To stop the spread of this, that is the wrong way to go. So I just implore everybody to please, if you're not feeling well, go and get a test, and then we'll work through the issues afterwards.
Okay. Now, I'm just reading through all the questions. there's so many vaccine questions about the appointments and such, and you covered those earlier. So we'll go back through those as well, or people can rewatch this on our YouTube. But a couple questions that haven't been asked. As far as I've heard that the reactions to the second doses might be a bit more severe than the first round. Is there any truth to that?
Yes,
Yeah.
that is what the clinical studies suggested. That there's, and I forget the specific percentage. It's not like it's twice as severe or anything like that. They're just proportionally more people have, and more people, younger people, have reactions than older people, which is kind of the opposite of what we often see. So the younger you are, and then the second dose would increase your risk of having some of the local. Now, the systemic reactions are generally gone within 1 to 2 days. So they're not particularly severe, but they are common. They are common. So be prepared for some body aches and low-grade fevers and a sore arm.
Okay. It's almost 10 after 4. We have a few more questions. Do you want to keep going?
Sure.
What would you say
Okay.
if I said no, cut me off?
You
You
goodbye.
wouldn't listen.
Oh,
You
I
would
would
not.
too. Okay. Let's see. Do you feel it's safe for students and staff to be back in school?
Agreed.
Well, some of our schools have been already in school all along. Go ahead, Justin. Go ahead.
Well, yeah, and I think Doc covered that a little bit too, right? I think we are working constantly with all of our school districts in the county, as well as our parochial schools, and so I would say that it's up to each school district to make their decision, but they constantly have input and coordination from us to make sure that we're doing the very best we can to get kids back in school. It is our goal to get the children back in school and to keep them there safely for as long as possible.
Yeah, and let's go back to that question, safe. And I think it really depends on what you mean by safe. Do I think it was reasonable to assume that if our kids and teachers go back to school, that they will not be exposed or come down with COVID? Absolutely not. No. This virus is everywhere, and if we do anything outside of our little bubble, we're going to get exposed. Someone's going to get exposed. Now, is it reasonable to assume that even with cases of COVID occurring within the schools, that we will not have any large outbreaks and we can contain them very quickly and be able to maintain the majority of students and teachers to be there and continue to learn? Yes, I do think that's possible. And I know it's possible because we've been doing it in a lot. Our parochial schools have been open all along, outside of the high schools that got shut down. We have a pretty good track record in this community. Our schools have been very cooperative, and I think we're gonna. It's not that it's gonna be safe in the sense that there will be no COVID, but I think it will be very doable, and it won't be any different than people going to Myers or to different. I'm sorry, I don't want to throw out Myers under the bus. Going to a big box store or going to another outdoor outside location where exposures are possible. Let's face it, the more we scrutinize a facility, the better, the less risky it's going to be. And our schools have been very focused on screening. I believe they're going to be building more testing into the routines, very much like they've done for their sports situations. We're going to have increased vaccine opportunities. So if anything, this is going to get better. And we've done pretty good already for the last 6 to 10 months. So I'm feeling pretty positive about kids getting back to school.
Okay. Are we trending influenza A and B? I can't find any information, even from Michigan.gov.
Well, it's there. They send out weekly reports. We are continuing to do the surveillance. I believe that's the last week when I looked at the My Flu report. You might need to look a little bit deeper, but on the Michigan.gov, there's an influenza site where you can see the updates. There it is. Thank you, Justin. Or Brandon, I'm sorry. Bring it over here. I said. So what I do is, so we're still at a pretty low level, and I like to go down to where they actually report southeastern Michigan. I think last time I looked, we only had 3 reported cases in southeastern Michigan. And so flu levels remain extremely low. Yep, 3. So 2 Bs and 1A, and they were both reported in southeastern Michigan. So, but really low levels of influenza throughout the country. In fact, they have a map of the country, and I think the only place that has some orange is Mississippi. So we're still in pretty good shape.
Jen, can I answer one of the questions from
You sure can.
from Crystal, the public school employee?
Yes, I'm just going to bring that up. Yep, go
Yeah,
ahead.
so I've been kind of tracking that. Here's the deal. We've already talked about this a few times, but we are up against a very scarce resource, and that teacher group was added just a couple of days ago. So we've been there's a flurry of stuff happening in the background to see what we can do and make that happen. However, we're up against not having the resources available to do it as quickly as people would like us to do it. So we are very willing to go above and beyond and make this happen for everybody that's in the 1B group and the top tier of 1C. And then with the adjustment of teachers going in, that's a lot of people in our county, about 62,000 people. And as you heard a bunch of times already, right now we're getting 975 at a time. So those numbers just don't add up. So we are working through potential prioritizations and things like that, but we're not there yet. And we're getting all the doses that we get every week into arms.
Yes, thank you. I was going to ask you about her questions. Okay. All the rest are just kind of repeats of what you've already said before. So let's just end with some closing comments, just to reiterate kind of how you started at the top of the hour as far as next steps for us with vaccine.
So vaccine is on its way. It's going to come out in little fits and starts, apparently, as opposed to a steady stream that opens up into a strong current. But as it is now, we have plans to expand our clinics as quickly as we can receive vaccines. So that might mean that we may have a couple clinics on the books that are filled up. And if we can acquire more vaccine, we will accelerate and put more up. So you got to keep your eye on our website and social media. Be our Facebook friend. We'll do everything we can to let people know, and be patient. Be patient. We can't vaccinate you without vaccine. As the need to use community partners and other resources to vaccine, that's going to expand as well. So keep your eyes peeled. But we'll let you know when other vaccine opportunities also arise, for instance, through pharmacies or other community agencies. So we're going to ask you for your patience. Remember that the vaccine is not protective until the second, at least a week after the second dose of the current vaccine. So you need to continue to use all of your common sense and the tools that you've used over the last 10 months to avoid infection. And we'll get there. We'll get there. Don't panic. Deep breath. This is really, nothing has changed compared to 2 weeks ago. Nothing has changed other than now you know that you can get some vaccine that you really can't. So, I think we just need to remember that this process is going to just kind of work its way through, and we have to be patient, and we just thank you for that ahead of time.
Justin?
Yeah, obviously these have been very trying times for our community, and we get that. It's been hard for everybody, and we're as human as the rest of you. And I just want everybody to understand that all of the resources needed, everything we can do to be ready to put the vaccine in people's arms, either has already taken place or is currently taking place to ensure that happens continuously until we get through everybody in our community. So like Doc said, we've kind of shifted gears. We've gone from just dealing with the virus to now having something that can help us on a large scale. But we haven't had the ability to scale up yet because we don't have that one resource, which is the vaccine. So patience is going to be the virtue here. And we are being as transparent as possible, coming on here every week and telling you the truth, even if we don't like how it sounds. So hang in there, everybody. we are in your corner, and we will do everything we can to both keep you informed and get you through this as quickly as possible. Have a great week.